Alright, so we're going to do an assessment today. We're going to do a neuro and musculoskeletal examination. I have my patient here, Lucy. She's a 25-year-old white female. Thanks for being my patient again. So here we go. So first off, we're going to start, and we're just going to go through your cranial nerves.
Okay.
Alright, so first we're going to test your vision. Just for the sake of time, I'm just going to have you read the first and the last line.
Okay. E.
Okay. And what
L. T. F. P. H.
Good. Alright. So she has 20/20 vision. Next, I'm going to look at your eyes. We're just going to test and make sure that they're equal and reactive. Alright, so they're round reactive to light, size 3 to 4 pupils, equal and accommodating. So that was an optic nerve. So now I want you to follow my finger, just with your eyes. Look up, and down. Good. Alright, so she was able to track in all quadrants. So that was cranial nerves 3, 4, and 6. Next, we're going to check your trochlear. So does this feel the same on both sides of your face? Good. Alright, so she's got equal sensation. I want you to give me a big smile. Good. Puff out your cheeks. Alright, and then I want you to stick your tongue out. Move it from side to side. That was the hypoglossal. Okay, and then you can relax. Shrug up your shoulder or your face for me. Good. Equal symmetry on both sides there. Does this sound the same in both ears? Alright, so vestibular cochlear is intact. And then I want you to stick your tongue out. Say ah. Okay. So I can visualize her throat. She has good normal voice. Alright, shrug your shoulders up for me and relax. Okay, good. And then I want you to, now we're going to test your strength of your extremities and then test some sensation as well. So I want you to stick both arms up in the air like that for me. Push against my arms and push down. Alright, now bend your arms just like that and lift up and push down. Good. And then I want you to squeeze both my fingers. Good, equal good strength there. And put your hands up like this, push against me. Okay, now keep your hands like that, resist me. Good. So she's got equal strength in her shoulders, elbows, wrists, and her hands. Next I'm going to test your sensation. So I just want you to close your eyes for me, and I want you to tell me if it's soft or sharp.
Dull.
It's fine. Yeah, dull.
Okay, that's sharp.
Okay.
That's dull. That's sharp.
Okay, good. Alright, so now we're going to test, we're going to do a special test called the feeling test. We're going to test if you have carpal tunnel since you work on a computer all day. So I just want you to raise your arms up like this and push your hands and just hold it there. Keep pushing against your hands. So normally you do this for a minute. For the sake of time, are you in any pain? Does that hurt?
No.
Okay, go ahead and relax for me. If it had begun to hurt or had any pain there, you would know she had issues with carpal tunnel. All right, so now we're going to move on to your lower extremities, and then we'll come back and we'll do your reflexes. So for your lower extremities, I want you to just relax your legs for me. Okay. I want you to go ahead and push up against my hand here. Good. I want you to push down. Good. And lift up. Push down. Good. So she's got good strength there in her hips. And then I want you to keep your legs up towards me. No, keep them up. Keep it up. Push against me and push down. Good. And same. Push up and then push down. Okay. And last thing, I want you to push your hands. Just relax your legs a little. Push down on my hands. Good. And lift up towards the sky. Good. So she's got good dorsal flexion, plantar flexion, good hip strength, and knee strength. So now we're going to go through her reflexes. I'm just going to do one reflex on each side. We're not going to do both extremities. Alright, so first we're going to do I want you to scoot forward for me a little bit on the edge of the couch. Okay, and we're gonna do.
Sorry.
All right. Okay, sit. No, just sit forward.
Okay.
Right there. Perfect. Okay. Lovely assisting here, right? All right. So just relax. First, we're gonna do your relaxer right there. We're gonna do your brachial reflex or your yeah. Good. And then your there. Good. And finally back. Just angle your arm there a little bit. Good. That one was very good. All right, now I want you to scoot back a little bit.
Okay.
Okay. We're going to test your patellar reflex. Very active. Okay. And then we're just going to have you relax here. I want you to push your like that. Good. All right. So all of your reflexes were intact: patellar, Achilles, brachioradial, bicep, and your tricep. So great. Now we're going to move on to the standing portion of the musculoskeletal. So I'm going to have you stand up for me. Okay. So first, I'm going to have you position so the camera can see you good. Okay, so I'm just going to inspect your spine. That looks good. Then I want you to lean forward and touch your toes. So I'm just going to inspect your spine. Good. No abnormal curvature, no signs of scoliosis. Go ahead and stand up for me nice and straight. And then I'm going to check your. So now I just want you to stand for me this way. I want you to bend down and touch your toes. Again. Good. Alright. And then I want you to stand up. I want you to twist to the side for me. Twist the other way. Okay. Alright. Any pain? Any resistance while you're trying to move? All normal for you. Good. And then we're going to test one more thing. So I want you to first, I forgot to do this one earlier, but I want you to touch your nose and then touch my finger. Touch your nose again, touch my finger. Good. One more time. Up here. Good. And do it with your other hand. Touch my finger. Okay. Good. There you go. All right. Well done, patient. And so then now I want you to do is while you're standing there, I just want you to take one foot and run it down your other, like your heel to your shin.
Like this?
No, more to the front.
Like
so.
this.
Good. And just drag it down.
Like
Good. Now do it with the other foot now and drag it down. Good. Okay. Excellent. Now I'm just going to observe your gait. So I want you to just kind of walk. I don't know how this will work with the camera, but I want you to stand here for me and just kind of walk towards me. Good. So there's no abnormality noted in your gait. And then I want you now to walk. And I want you to walk on your heels. Good. And then I want you to relax. And now I want you to walk on your toes. Very good. All right. Go ahead and relax. Sorry, my computer is. Okay. We're almost done. So yeah, your gait looked really good. There was no imbalances. The last thing we need to test, we're just going to do an extra test. So I'm going to have you lay down on the couch for me. This test is the McMurray test. It's used to test if you've got a meniscus tear. So I'm going to take your leg here. I want you just to bend it up to 30 degrees. There. All right. So now I'm gonna move your foot inward first. I'm just going to move it back and forth. I'm just feeling for any clicking, rubbing, any noises. Okay. And then I'm going to move your foot in the opposite direction, laterally. Do the same thing. Okay, so that was normal. So congratulations, you're done. You can go ahead and sit up for me. Thank you for being our lovely patient today. And come